it doesn't address the underlying cause of androgenic alopecia. So we know that hair loss is multifactorial, but we also know that a big part of androgenic alopecia, the underpinning thing that is leading to miniaturization of the follicle, is this interaction. It is this predisposed sensitivity that your follicles have with hormones floating locally in the circulatory system in your scalp. So DHT. PRP does nothing for DHT. It does not counter the effects of DHT. When people see best results from PRP is often when they're combining it with other ingredients. Often minoxidil is said to have a better effect and has been shown in studies to have a synergistic effect with PRP more so than PRP or minoxidil alone. Why? Well, as we see with microneedling, you can increase the potential of minoxidil because you increase the amount of the enzyme that is circulating locally by activation from the trauma that is created in the scalp. You increase the amount of the enzyme that converts minoxidil from its prodrug form into its active drug form. So yes, when you have PRP with other ingredients, you're going to get a synergistic effect, which might then crop PRP to look better than it actually is. Likelihood is you probably achieve just as good results if you used a microneedling device and saved yourself the thousands. But PRP does not address the underlying cause. It does not address the DHT component. It does not address the hormonal component locally. So even though you might get a bit of a growth spurt for a few months, if you don't support or if you don't address the underlying cause, you're not going to stabilize the loss and you're not going to have best results ongoing.